Welcome back to our show, Doc Talk, where we talk about primary and specialty care here in Southern Nevada, mostly in Pahrump, and we've also had guests on the show in Vegas, North Las Vegas, things like that. Welcome back to the show. We really appreciate coming out. The whole idea of this whole show was to get to know the wonderful services we have here in this town. And today we are joined with another brand new addition to Pahrump Cardiology and Primary Care, Dr. Julie Woodward. She is joining us today. She's been wonderful to come out. We had actually Dr. Eric on the show a few times in the past, and they're growing the practice, and they're really trying to expand services. Everybody knows Dr. Eric for his cardiology stuff and what he's done for the community with cardiology. He's invested so much money in cardiology care here in Pahrump, and he has a vision. That's something I love most about his practice. He has this vision to make Pahrump this great place for medical care. And it's not just about getting the cardiology and great care. And he's invested so much money on new equipment for cardiology and imaging and things like that. But he's focused on getting primary care. And he's hired like Melanie Lentz, the nurse practitioner. And now he's added Dr. Woodward, who's added even more services, which is super awesome. And we're going to talk about that. We're going to go through some slides. Their practice, they even have some professional slides for me to show on the screen. We're going to talk about that. But let's hear about Dr. Woodward. Tell us about yourself. What school, where'd you come from? Like your medical background, how do we know you?
Well, first off, thanks, Brent, for inviting me. This is a great opportunity to meet the community, meet yourself, and talk a little bit about the services that we provide. So my career, I actually started off as a registered nurse, went on, became a nurse practitioner, and then went on to medical school. So I have had a long road of education and a lot of different experience to be able to provide to the community here. So I'm very excited to be able to provide those services.
Yeah. So that's kind of, all the realms. We've talked a lot of nurse practitioners here too on the show, and it's like you see the whole gamut of things. So your care is a little bit more different than everybody else's there.
Yeah, it's very comprehensive, and I think that's one of the things that the patients love. So the patients that see me are so appreciative. It's rewarding to see the appreciation from the community. They appreciate that quality care. No one wants to be rushed in and out of the exam room. They want to be heard. They want a good exam. They want to have the adequate testing that they need. And that's what we make sure we give them.
Yeah, that's my biggest frustration sometimes is, okay, I want to see the doctor, and then it's like, go here and there, bouncing all over around, getting testing done. It's like, why am I going around everywhere?
You mean that uncoordinated care? Yeah, that's exactly Dr. RX's vision, is to make sure that we have coordinated care. We want to make sure we can provide as many services as we can under one roof. So we're providing things like cardiology, primary care, pain management, women's health, and we're offering different services like allergy testing, but not just basic allergy testing and asking you to go and get a lab or a laboratory test. We're doing the testing in the office. We're doing the sensitizing treatments afterward. We're doing full service testing. So the services that we're providing are very comprehensive. And yeah, the patients don't have to go from place to place to place. And it's very helpful for them.
Oh, definitely. So I want to learn more about you. Like we talked about the practice stuff like that. So like you went to medical school. You've been here in Pahrump for practicing medicine in Southern Nevada for about 10 years. I think you said earlier.
Well, I've been practicing since 1997, so for quite a while.
Yeah, you still look really young. So
well, thank you very
much. It's like youthful
but I'm
and
a
everything
grandmother.
like that.
So, yeah, I have many years of experience, but I find it very rewarding, and I love doing what I do.
Yeah. And you've been practicing, and you've been in Southern Nevada for quite a long time too, right?
Yes.
You went to high school here, which is like really
did.
cool.
I graduated from high school in Las Vegas, Nevada.
Yeah, we love our locals and stuff. We know they're going to be here for a long time.
We do. And that's one of the great things about our practice is that all of our medical team we're all local. We all live here, and that means a lot to our community. And it was funny, when I first started practicing here, individuals would ask me, "Do you live here?" And that was their test, and I found out they were asking, "Are you going to stay?"
Yeah,
that was their
exactly.
nice way of saying, "Are you going to stay?" If you live here, it means I'll come back and see you.
Yeah, because the thing about, like we come and go, we're so used to the small little community, and so many specialists and stuff like that, they come to Vegas, and it's always like, they rotate them out. It's like, so they're here for a short period of time. You get to like your doctor and
And
get
they're
that
gone.
care. Yeah, and then they're gone, and you're like, well, wait, I gotta establish with something brand new, and it's like they got to know me really well, and that's a big deal, and we like the local stuff, and that's get to know you better. It's like, hey, she's actually legitimately something I want to put my trust in,
And committed to the
committed.
community.
Yeah,
Yeah,
exactly.
absolutely.
And then also we have a lot of veterans here, and you mentioned your husband's even a veteran,
Yes, he is.
and retired and stuff. So you understand a lot more of the veteran stuff, and
Yeah.
a lot of comforting knowing that hey, you served a country and you do all this stuff, and it's great to know that hey, I can understand that side of things, not just the. It's more about compassion.
Absolutely. And it's very funny that you bring that up because I've seen so many veterans this past week. They've said, "We've seen your ad in the paper, and that's why we came to see you." And they really appreciate the care. So it's very rewarding.
Yeah, exactly. So from cardiology, primary care, and they have they have two offices. Just to remind you guys know where they're at. And we get a lot of confusion about the offices and where they're located. In the Loop Road office is where they have a lot more of the big cardiology equipment and the scanning stuff, and that it's in that old Intermountain Healthcare / Healthcare Partners building that used to be there. They're in there, and that's where the cardiology stuff does. And Dr. Woodward works out of that office as well.
Yes.
And then they have another office off of Calvada, which is where they do most of their primary care stuff, and they do that off-site because that way they can be more. They do the two places that way they kind of separate the service a little bit more, and you're not. Yes, you do have the same paperwork, same exact people in there, and you have the ability to get your primary care a little bit separate facility, and that way you can see. I think Melanie Lentz and then Dr. Woodward works in that office as well. So you're kind of everywhere and things like that. Do you have certain days at your certain offices usually?
Yeah, Monday through Wednesday, I'm down on Calvada, and then on Loop Road on Thursdays.
Okay, so one day a week over there.
Yeah.
Are you doing mostly specialty care on Thursdays, or is it also primary care out there?
Honestly, it's a little bit of everything every single day. And what I found is my schedule filled up so fast. It's now a couple week wait just to get in to see me.
Oh, wow.
And Dr. Arik and I were talking about how things are growing so much that we are actually planning on expanding and hiring some more help.
Yeah. So we want to get in to see them. Yes, it is a couple weeks out to see them, to see Dr. Woodward, but they're going to get you going and stuff. And then I think is Melanie Lentz's, her schedule's a little bit more open too than yours.
She's
right? Or
getting
still
full
pretty-
too, and she provides that wonderful, great care. Actually, she's my PCP. I absolutely love her. She's amazing.
Yeah, so I know that's the biggest thing. We want to get in to see the doctors, and we love them when we love them so much, and they flood to them quickly.
Yeah, I have to wait 2 weeks to see her. No.
Exactly. We want to see them in. And you guys work with, if they're sick or things like that, can you guys work with like same-day appointments,
We
things
do.
like that? Yeah.
And if we have somebody who's just gotten out of the hospital, we'll squeeze them in. And I'm notorious for staying late and doing whatever we have to for critical patients to get them in, whatever it takes for our patients.
And are you guys doing a lot of virtual meetings as well, or is it mostly all in person still?
Right now, we're really seeing people in person for the most part. We have all the safety precautions in place for our clinic, and we're keeping everybody socially distant so we can see them in person.
Yeah. I know a lot of people that's kind of a frustration. It's like they want to go to the doctor, but sometimes some doctors aren't even seeing patients in the office. It's like, well, I have to do virtual. Like, well, maybe you don't like virtual. It's nice to know you're just still seeing patients in there.
Yeah, and I've actually had some patients that have transferred because they were only receiving phone call after phone call, and they were very dissatisfied with that. They said, for pain management, no one's assessed me. How can you really assess me on the phone when I have pain? So when they come in, I'm definitely assessing them, and they appreciate that.
Yeah, especially we have a lot of need for that out here, a lot of pain management stuff. And we've been used to having to go out to Vegas or another specialist to go see it. It's nice to be able to have somebody that can probably do that as well.
So we're offering the interarticular injections that are image guided, and no one's doing that here in the community. And we have an older population, and a lot of people have degenerative changes, and they need those injections. It really helps them a lot.
Yeah, I was actually reading, somebody posted on Facebook, and I was like, I guess the average age here is about 66. I was like, that's kind of surprising. I didn't realize that we had that demographic. I don't know how that average goes out.
Well, because they're averaging a newborn with somebody who's 90.
Maybe, I guess so. And then we have a few even World War II veterans out here too. It's kind of interesting though. They kind of roam all over the place here in Pahrump. And I have young kids still myself, so I guess I even out a little bit the lower end. You guys meet my family and stuff. But that's wonderful. What else besides, so you're doing a lot more the specialty with pain management, and that's, do they actually have to see you as a pain management doctor? Is that a specialist usually, or do you see that as a primary care kind of visit usually?
If it's for medication management and it's not just something minor, it's a separate specialty. And we require, all of the state required consents and agreements that need to be put in place to make sure that we're doing everything by the book. So, yeah.
That's always a curious thing, because I know a lot of, in the past, primary care doctors have been like, okay, I'll prescribe pain medications. But state law in Nevada recently changed, and people blame their doctors, like, well, I can't do primary, I can't do it. And it's like, everybody's like, well, I'm frustrated with them. Like, it's not that they can't prescribe it, it's just they have different rules they have to abide by.
Yeah, we have to protect our license and we have to follow the rules. It's what the state of Nevada requires. So we jump through the hoops and do everything by the book.
Do people have to actually referrals to see you for the pain management stuff, or is it something part of the practice with?
No, they can just give us a call and we'll schedule them and do the initial visit and determine if we'll continue their regimen. Sometimes we'll have individuals with really, really exorbitantly high levels that are not typical, and those individuals may be people we don't accept to the practice.
Oh, okay. Now, what is do you know the phone number off the top of your head for cardiology?
Yeah, 775-210-8333.
Yeah, we'll put that up so you can see it. So it's 210-8333. Give them a call. Talk to the front office staff, get an appointment to see them, and that way you can get to see a couple weeks out, because they are super busy. And Dr. Woodward's only been with Dr. Eric for just a few weeks.
Since this summer?
Since summer, summertime, yeah. Not very long, but she's already getting filled up because people already love her. She's wonderful. You can see on the show how wonderful and great she is, and knowledgeable and caring, compassionate. She does everything for you. And we're going to take a break. We're going to come right back. I'm going to go through the slideshow that they really wonderfully put together. We're going to do a few little slides and talk more about the practice. Probably on a few things you've already talked about, but I want to go a little bit more in depth. And we'll talk to you soon. Thank you. Welcome back to DocTalk. My name is Brent Leavitt, owner and proprietor of Battleborn Financial Advisor and Health Insurance Broker here in Pahrump, Nevada, and also in Southern Nevada and Las Vegas. We have a lot of Vegas viewers. And we are joined today, again, just to remind you, with Pahrump Cardiology and Primary Care with Dr. Julie Woodward. She has been living in the community for quite a long time. She's I would consider more of a native myself. She went to high school here and everything in Southern Nevada. And she has been working with us in summertime here with Pahrump Cardiology. We got to know her a little bit better in the last section, so go back and look us up on YouTube and check us out. Rewind a little bit more and see more about what we talked about in the beginning. We're going to do some slideshows a little bit. Pahrump Cardiology is probably the best. They talk about more about what they do, and we're going to click through these and talk about what they're doing here. Some of their services they offer is the cardiology stuff. We've met with Dr. Eric in the past, talk about how they have great heart monitoring programs. If you're in Vegas, if you want to come to Pahrump and get your heart monitor and checked with Pahrump Cardiology, he has some equipment that nobody else in Southern Nevada even has. So it's worth coming out to Pahrump for that. Even we're just an hour away, not even that with the new pass being opened up. Primary care, they have wonderful doctors. Dr. Woodward does a lot of primary care, specialty care, and also Melanie Lentz here does that. They even dabble in like women's health. A lot of people here in Pahrump, we struggle with getting women's health taken care of. And that's a great program out there in getting those wellness checks. Pain management, that is the biggest thing that I think the biggest frustration we get is I have to get the referral to a pain management doctor. They're super long waits to get in to see them and 3 to 4 weeks even to see that. And then it's like you get chronically taken care of. And then sometimes you feel like you're a sheep getting in and out. And it's like, I need to get my pain management stuff done. And they just feel like you're being pushed away. Pahrump Cardiology takes care of that with regards to your primary care, even kind of makes it in there so that way you can get the pain meds and stuff you need. They even do weight loss. And I'm going to talk a little more about allergy therapy with you as we go forward, because that's something that I'm actually really interested in. We've had to go to Vegas for that for so long. It's almost a point where it's like it becomes a nightmare driving every week to get that chronic, that immunization taken care of for you. And even more, Dr. Eric has this vision to make Pahrump Cardiology and primary care this like one-stop shop for everything. I think we've even kind of quietly in the past talked about how he's going to grow this big practice and he's going to build this great big building for us eventually. I think more to come, and just to be determined with this great vision of how they're going to have this wonderful medical care here in town. Let's go to the next slide here. We've talked a little about chronic pain. Just tell us about we talked a little bit about it in the past, but tell us more about this section here, Dr. Woodward.
Yeah, so a lot of the individuals come in with pain in their joints, and we see it so often, shoulders, knees, hips, and we have the capability of using imaging and actually giving them blocks and assisting with that pain. Instead of just masking their symptoms with maybe opioids or over-the-counter medications, we're able to practice a multimodal approach, and that helps the patients quite a bit. For individuals with acute injuries that also have significant muscular involvement, we can do the trigger point injections, and those are very, very helpful. And we've been doing quite a few of those right now. I would say each week we have I would say probably at least 20 people a week that we're seeing for these types of issues.
Yeah, and probably we'll get, now that we have this airing, we'll get probably a lot more too. You guys will call the office, and don't forget to give them a call, put the phone number up there as well. We'll know the next slide there. And then this is the biggest thing for me, especially here in Pahrump in Southern Nevada. I don't know if anybody, allergies is a huge killer because every time the seasons change, the wind blows. And dust is everywhere here in Southern Nevada, and it's like everything just blows up.
That's every day.
Yeah, it's crazy. I know it's like people come to Vegas, or Southern Nevada, Vegas, Pahrump, and everything like that. It's because we want to get away from the allergies of other places. But we even our own here, it's just it's a different allergy. And we forget that, man, that dust and allergies get you. So tell us more about the allergy stuff like that.
Yeah, so sometimes individuals don't even realize what they're suffering from are allergies. They say, oh, I have itchy skin. Oh, my eyes are watering. Oh, my nose is running all the time. And they don't realize they're suffering from allergies, or they're just masking their symptoms with over-the-counter products. We have the capability of doing 72 allergens that we can test in the office. And based on that, we formulate specific, individualized, sensitizing treatment that the individuals will take and sensitize to over the year. And then they would have no need for those over-the-counter products. We also see this in our individuals with asthma. So people with asthma can sensitize as well, and they'll have a lot less reliance on those products.
Yeah, that's wonderful. And my son was going through some of these in Vegas, but it was just the drive back and forth. There's just been chronically, it gives you on gas, time, and everything. And it's like, hey, it's local in Pahrump, and we have it here. It's wonderful. And it's off of Calvada. It's really easy. That's what you guys do, them to allergy stuff.
Yeah,
Calvada
we
one.
do.
If you ever get a chance to go to that office, check it out. They'll even do a little tour and stuff. They even have like a nice conference room. Dr. Eric, they spent money to make this place look really nice. Everybody looks on the outside where like the Calvada stuff, it's like, oh, it's not that great. But I mean, they did a beautiful, beautiful job. I'm just letting you guys know if it's great and it's comfortable walking in there. Go ahead and get the next slide. And then I want to come back to us a little bit. Again, this is their team here. We have Dr. Woodward, and then Dr. Eric, the cardiologist, and then Melanie Lane. So you got wonderful, beautiful pictures of all these great people. I think he has a little bit of thing of trying to get, make you feel comfortable, make you understand who they are, and they want to make sure you feel informed. They very much listen to you. That's the biggest complaint I think we get with medical care is to listen to me.
Yeah.
So come back to us a little bit. Talk about the practice. I want to talk about insurances and what they take here. They contract with a lot of the commercial plans with regards to if you're with an employer group, they take like United Healthcare PPO, Sierra Health and Life PPOs. They also work with a whole lot of Medicare plans. I think with the average population being a lot of Medicare, you'll find they take a lot of original Medicare clients. They have a contract on the primary care side they work with P3 Medical Group, which encompasses about, in Pahrump, we have about 4 different plans. That's Anthem, the Mediboo Plus plan, the P3 plan. They take the Allwell P3 plan. They also take Aetna, and they're also contracted with, I'm missing one, Senior Care Plus. And that one, they all use the P3 network, and that's, you can see them for primary care. And also, they also have a contract with P3 in specialty care. We have a lot of members out here that are on Humana, like the Gold Plus plan, Unfortunately, you do not work with them on primary care, but Dr. Eric on the specialty care works with the Humana HMO side of things. And they also, primary and specialty, they're on the Humana PPOs.
Yeah.
They take quite a few different insurances. You've got to make sure, talk to your broker about when you see them for primary and specialty care, which plans they take. That's why we exist at Battleborn Financial. Give us a call, the 775-764-2252. We're at local. We're actually off of Commercial Drive. Commercial Drive is the one, we're right in between the Goodwill and the urgent care. I always tell people nearby the gym. It's easy to find us here locally. Work with us and we can help you through. Most people don't know this as well, but reminder that Medicare open enrollment's kind of passed already for the Medicare's time. Doesn't mean it's the end of making a plan change. A lot of people, especially during COVID, we've kind of felt a little bit isolated what to do, and we relied upon like Joe Namath on TV to tell us what plan we're going to buy, and we called those call centers and stuff and find out that maybe might not be a plan we thought it was. Between January 1st and March 31st, don't forget that little time frame. I call it buyer's remorse period. You're allowed to make a one-time plan change during that time frame.
Absolutely.
And it's like, hey, maybe you missed out and you found that you didn't see Dr. Woodward in your plan, but you're like, man, I really want to see her. Give us a call and we can make a one-time change and we can get you to see her on your plan. And there are some great programs out there where we talk about allergies and medications and stuff. There are plans out there that cover a lot of those allergic medications at zero cost. Mm-hmm. We can get you things like your inhalers sometimes at zero cost, which are super expensive. That can be a big deal, or even reduced. Even some we didn't talk about diabetic management, but we can get insulins covered at no cost. Mm-hmm. There's ways to get things like over-the-counter supplies very, very much. Even if you are dual eligible for Medicare and Medicaid, there's great programs. This year is probably the best ever for the dual plans.
Absolutely. You are so correct.
Yeah.
And not all the insurance plans are the same. And some of the individuals that come in to see me, I'm very limited in what I can order for them because they're on a certain plan and it makes it very difficult and the individual can't afford to pay cash for those expensive tests. So they really need to do their research and definitely reach out to you so we can order those things.
Yeah, so it's very important we coordinate the care and everything like that. I know that's the biggest concern is just getting everything back and forth and whatnot. So let's go back to the last, I want to have insurance stuff like that, but let's go back to that last slide again, the next slide. I know we had that up there. There's a reminder, they have 2 locations to serve you. The Loop Road location, and just a reminder, just up the street on Loop Road is my office, Loop and Commercial. And then Calvada is also where they're located at Prump Cardiology. You can see that, the Calvada Eye. I think we have one more slide, is that right? Go ahead and do the next one. If not, go back to us. Yeah, thank you. Talk about Prump Cardiology and like that. They're actually going to have the big slides showing in their conference rooms and things like that.
In the lobby.
In the lobby and everything. Sorry, conference room lobby. And look out for more things to come from them. They have such big plans to do things. Hopefully, we'll do some big meetings. If you guys want to come to the office, check look for your mailbox, look in the paper. They advertise like crazy in the paper. I think you said a lot of people see you in the paper.
We do. We get a lot of people saying that they saw us in the paper. Yeah.
So don't forget to give them a call. And give us the phone number one more time as we kind of go forward a little bit.
775-210-8333.
Yeah. And just let them know, hey, I want to see them for primary care, for specialty care. Some plans do require referrals for the specialty care. So make sure you're getting those referrals and stuff like that done. Some plans do not. If you don't need referrals, make sure you just let Dr. know, because you don't want to be seeing cardiologists for stuff that you don't necessarily need. But remember, primary care, they're great for that. They take all of the P3 plans. Even if you're on a P3 plan already, and you're like, you know what, I really want to switch my primary, you can change your primary care doctor. They don't lock you into a certain primary care throughout the year. Yeah. It's kind of the choice you have with anything like that. And then make sure you work with your brokers and tell them, hey, I really want to see them and get connected with that. Until next time, we're going to be back again next week. Don't forget to tune in. Tell your friends and family that we're here at the show. Share it on Facebook and let everybody know that we're here to help you out with your needs. So thanks again. And thank you so much, Dr. Woodward. You've been phenomenal, and it's great to have you here.
Thank you, Brent. I appreciate it.
Thank you. See you next time, guys.